Welcome to Wellbeing Guide TV. Today we're presenting Susannah Patch's journey from cancer to wellness using natural therapies and diet.
Hi, I'm Nikki Freeburn with Awaken the Heart Centre, and today we're going to be speaking with Dr. Katalaris and Susannah Patch about her journey with cancer. So firstly, I'd like to welcome Dr. Katalaris, and if you'd like to give a bit of a background on your medical knowledge.
I graduated Sydney University in 1982 and spent 23 years in various forms of hospital-based medicine, predominantly with an accent on medical research and pathology and a little bit of forensic pathology. The last 6 years was spent in clinical practice in North Shore Private Hospital. My main interest now, having seen 23 years of less than effective allopathic interventions, is to develop better medications centred around diet and cannabis.
So what experience have you had around cancer in relation to patients with cancer?
Well, it's been 23 years of watching the failure of allopathic medicine, basically. Chemotherapy is a very arduous process for a patient to go through, and it's becoming increasingly obvious that it's in large parts self-defeating, right? Deep X-ray therapy is a known carcinogen, and it's bizarre that we're relying on deep X-ray therapy to treat cancers. It's just logically incoherent. The chemotherapy drugs equally are carcinogenic, and they're accepted as carcinogens, and even survivors are at risk of recurrences 20 years down the track with a different sort of cancer, a treatment complication.
So if someone doesn't understand what carcinogenic means, would you be able to give that a bit of an explanation to them?
All right. Yeah. The cancer chemotherapy drugs can themselves cause cancer. There's no doubt about that. I mean, cancer chemotherapy started in the First World War when it was noticed that soldiers exposed to nitrogen mustard gas actually had their bone marrows wiped out. So that's how cancer chemotherapy started. Didn't have a very glorious beginning, that's for certain.
So in your expertise, in the experience that you've had around this, do you feel that those traditional medicines, as in the allopathic or the chemotherapy, do you feel that they have any place whatsoever in cancer treatment?
A very small place. Right? I mean, firstly, we have to talk about surgery, and a high-quality surgery does have a place in control of the disease and acute intervention and other issues like that. Cancer chemotherapy, there's only very few tumours that respond dramatically to chemotherapy. That would be certain cancers of the testes, choriocarcinoma, or a cancer of the placenta. The rest, and Hodgkin's lymphoma, these respond reasonably well with more than a 10-year long-term survival rate. All the rest, the figures are nowhere near as clear, and in many instances, the patients actually end up dying of the treatment rather than the disease itself. In fact, we have no idea what the natural history of breast cancer is, let alone what breast cancer treated entirely with dietary means would do, because we haven't done those studies in a formal way.
This is a very comprehensive subject around cancer, and as you say, bringing in all those elements, the diet, etc. Yeah. So we're just going to meet Susannah, but thank you, because I think that information we're going to have a look at with the case of Susannah. So thank you.
We'd like to introduce Susannah Patch, who has had her own extraordinary journey with cancer and cancer. So Susannah, tell us about the diagnosis. How did that come about?
Okay, I went to my local GP in July of 2011 with a concern about a lump in my breast. He then told me to go and have a ultrasound, which I did. And from there, it proved that more tests were required. So I went back and had a biopsy, and that's when we found out that I had a high grade 3 cancer of the breast.